Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. New data released by the World Health Organization says a whopping 47 lakh Indians died of COVID. This means that India probably has the highest number of COVID fatalities in the world. The numbers are truly astonishing. Nearly 10 times the official number that the government has of just above 5 lakhs. Now, India has gone on record to say that the World Health Organization numbers are not reliable and that they rely on a model of calculation which is not authentic, particularly since India says that reliable data is available officially. But the World Health Organization quite clearly is sticking with their numbers. They've come out with a press release endorsing this very detailed study which they've done. India needs to know, all of us need to know, how many people died of COVID. Is the government number truthful? Is it correct? Is there a morbid undercount which has taken place? And if there is a morbid undercount, is it to the extent that the World Health Organization has said that it is? 47 lakh Indians, the World Health Organization, it's the most reputable, it is the most reliable, typically, organization of its type in the world. And they've come out with this and they're sticking with their numbers. The government of India says nothing doing. We'll bring you both sides of this debate. First, let's take a look at what the World Health Organization says. It says that India's COVID deaths are the highest globally. If you just compile the numbers, this is what comes. The World Health Organization says over 47 lakh excess COVID deaths in India. The government of India's data shows 5.23 lakh deaths. The government of India says the World Health Organization's estimate of deaths, I beg your pardon, the World Health Organization's estimate of deaths on the basis of what they're projecting now is 9 times more than India's. Now, India has hit out at the World Health Organization study. India says that the World Health Organization study lacks academic rigor. India says that the World Health Organization hasn't addressed our concerns. India says the World Health Organization estimates are based on other estimates. And India says that the World Health Organization study disregards actual data. We're going to be debating this now. We've got a fantastic panel from around the world. Dr. Bhramar Mukherjee, the health data scientist at the University of Michigan, with us. She's come out with her own set of statistics a long time back and has consistently argued that there was an undercount in India. Dr. Rajiv Dasgupta with us as well, Dr. Sunila Garg, Dr. Rajiv Jayadevan, Dr. Prabhat Jha, Professor Gaurav Ballabh of the Congress, and we've got PKD Nambiar, who supports the BJP. Let me go across to Bhramar Mukherjee first. Bhramar, your first reaction to this number, it's astonishing. 47 lakh Indians died of COVID. Do you believe this is accurate?
Thank you, Vishnu, for having me on the show. First of all, I do not think it's astonishing.
You don't,
I
right.
think that multiple studies now, the WHO estimate is an added evidence to various studies led by many people, the IHME, the Economist estimate, Dr. Jha's study, which has 3 sources of data, all point to an estimate in the range of 4 to 5 million deaths. So I'm not surprised.
You're not surprised at this. All right. I'll come back to you in a moment. Dr. Rajiv Dasgupta, as Bhramar points out over there, there are multiple studies all done by reputable people who stake their credibility by coming out and saying these numbers. And now it's the World Health Organization with many data scientists who are part of it who say that 47 lakh died in India of COVID. Do you believe that this is credible, this study?
Thank you. It's not a question of believing or not believing. I think what's getting misconstrued here and what needs to be set right at the outset is that these are not all COVID deaths. These are deaths, excess deaths associated with the pandemic, which means these are COVID deaths which are counted and reported. These are COVID deaths which are not counted and therefore not reported. And this also includes deaths which are indirectly associated with the pandemic that had caused complete strain and stress on various systems, the health system, the social system, and so on. So to simplify this, it's akin to, for example, if a bridge breaks down, so there may be some deaths which is directly associated with the trauma. Those who were on the bridge may be dying. But if that bridge is cutting off a very large area from where because you can't cross the bridge and access health services, there would be deaths due to heart attack and snake bites and so on. So when you count the excess death associated with this event, all of them are not directly due to the bridge falling down.
No, but Dr. Dasgupta, on your point, this is what the WHO says, and I quote, excess mortality is calculated as the difference between the number of deaths that have occurred and the number that would be expected in the absence of the pandemic based on data from earlier years. I understand that you're saying that, look, that would mean that people could have died of many other causes as well. I understand that. But the fact of the matter is that we had COVID. It is a known killer. And therefore, shouldn't one actually accept the fact that this huge higher number, at least to a high percentage, would be because of COVID deaths?
Yes, of course, but not all of these are directly COVID deaths. And I read out the third bullet from the WHO report, which is that it includes deaths indirectly associated with COVID-19 due to other causes and diseases resulting from the wider impact of the pandemic on health systems and society.
And I'll interrupt you again and come back to you because I want to read out that point. Again, the WHO statement, excess mortality includes deaths associated with COVID-19 directly because of the disease or indirectly because of the pandemic's impact on health systems and society. Right? Deaths linked indirectly to COVID-19 are attributable to other health conditions for which people were unable to access prevention and treatment because health systems were overburdened by the pandemic. The estimated number of excess deaths can be influenced also by deaths averted during the pandemic due to lower risks at certain events like motor vehicle accidents or occupational injuries. Doctor, this is all very important. If a person is unable to be treated for a major condition because there was no hospital bed available, then it is associated with COVID. How do we not accept that number as well? Similarly, if there is a COVID patient who would normally have survived, go to a hospital and not have oxygen, as was the case in our country, and they died, that is directly because of a missing health infrastructure for whatever the reason. So again, that should be counted as a COVID death. No, sir? Dr.
Are you asking me?
Yes, sir.
It is a death associated with the pandemic. That one needs to make a distinction between associated with the pandemic and a COVID death. I am merely making that distinction, and therefore it is very large for a country with such a vast population and extremely challenging conditions across the country. One can understand some of these excess deaths.
Okay. Dr. Sunila Garg, just to the point that Dr. Dasgupta makes over there, that we need to understand what all the WHO is counting. A lot of people would perhaps suggest that you absolutely have to count deaths related to COVID and put it into that number, because when COVID affected every aspect of our society, of our lives, right, of our health infrastructure. And therefore, one can't just look away from that. Do you accept that argument? What the WHO says?
I accept that argument totally, because you see, we have to see that India is very vast. The systems were overburdened in some of the states. We are a country of 36 states and union territories. That's where we can see that the systems were overburdened in Delhi or in Kerala or in Maharashtra. So, but we cannot say that the systems were same. If I talk of Dadra and Nagar Haveli, where there were only 4 deaths, we cannot say that each part of the country is comparable to the other part of the country. So that is where I have always been telling that you have comparison with what are the deaths which have been reported with the Registrar General of India. Look at the direct and indirect causes, but overall the figure is highly inflated. That's what I feel.
Why do you feel it's inflated, ma'am?
Because you see, that's what I said. The pandemic was not uniform across the country. As I said, that the number of cases across. You saw the systems were strained across majority of in majority of the places. They were across Delhi. You look at Maharashtra, like in Mumbai, or you look in Kerala.
So, ma'am, you're saying that extrapolating data, as in the way that the WHO has done, assumes that there is a uniform death rate, possibly because of COVID, direct or indirect, across the country, which you feel is not the way to do it. Is that what you're suggesting?
It's not the way to do it.
Okay.
Because you see, every country's, each of the country, if I'll say Pakistan or I'll say, any other country like Peru or Israel, basically when we look at, these are equivalent to one of our states. So that is where it is important to look each of the state in our country is very different.
Got
The
it, got it.
systems
I just want to
different.
bring in Brahmer on this point. Brahmer, you're a health data scientist. You work with these numbers. How has the WHO, to your understanding, calculated this? Is there a one model fits the entire world principle which should be used for India as well?
So thank you for that question. And I want to declare that I was a part of the technical advisory group for WHO. But what I'm saying here is in my independent knowledge as a statistician. And I really applaud the effort by John Wakefield and his team in positing this model with incomplete subnational data. So, of course, the gold standard, the best will be to have complete all-cause mortality data over the years from not just 2020, 2021, but the past as well. But with subnational data, you have to make assumptions. And so different models makes different assumptions. But I would like to point out to Dr. Jha's study why I feel all of these estimates are in the ballpark and these assumptions are attainable is because that's a nationally representative voting survey as well as healthcare facility deaths. So multiple sources of data, not just the civil registration system, have corroborated this fact. And the IHME model has used a machine learning tool to come up with different covariates that predict mortality. Of course, knowing the observed all-cause mortality from all states and union territories will be the best. But what can we do when that data is not available?
Right.
And I personally, if you think of my opinion as a practicing statistician for 25 years, if it has any value, I have reviewed that methodology and I have strong confidence in that methodology. And I think it's a very useful tool for predicting mortality in the future as well.
And the model that you use or you suggest is obviously deeply peer reviewed, right? It's not something that you've thought up and you've sort of applied. I think that's the point that needs to be made. None of this, neither your model or Ashish Jha's model or the WHO model is one scientist. It's peer reviewed, the model of statistical analysis. And therefore there are data scientists who've agreed on this, not based on any bias or any mistake. It's been cross-checked. That's the key point.
So the IHME paper is published in Lancet. Dr. Jha's paper is published in Science. And this paper that John Wakefield's group has led is undergoing very rigorous peer reviewed. And I have read that paper myself. So I think that people are with credible qualifications.
All right. Dr. Jha, you had your hand up. Go ahead, sir. Do you accept these numbers?
I accept these numbers, and in fact, the Indian government's release of the civil registration data in 2020 corroborates the WHO estimates for 2020. And let me explain how. There were 8.1 million deaths in 2020 recorded in the CRS. If you compare that against the average of the two previous years, you shouldn't compare it against 1 year. That's cherry picking. Compare it against the average of the two previous. The difference is 0.8 million deaths.
Okay.
What is the WHO's estimate for 2020 deaths? It's 0.8 million deaths. What is our estimate based upon the national polling data? Well, it's 0.6 million deaths, but we only covered 8 months. So the CRS release of yesterday and my esteemed colleague, Dr. Vinod Paul's editorial does not refute the WHO numbers, it corroborates them, at least for 2020. If the Indian government wanted to get to the truth of what is going on, then release the civil registration system data by week, not so you can look exactly during the peak months, peak weeks, was there an excess? And one more statistic before I hand over the floor. If you use that same metric, then let's look at Maharashtra. Maharashtra had a 19% excess of 2020 versus earlier deaths. The Indian average was 11%. So, and that's exactly consistent with the WHO numbers. And we all know in 2020, Maharashtra was particularly hard hit.
Right.
So the Indian government's own data is corroborating the WHO estimates, at least for 2020.
I'm just going to read out a bit of what the government of India in this four-page statement has said. They've disagreed completely with the WHO statement. But one of the points they say is that India had pointed out the inconsistencies in the criteria and assumption used by the World Health Organization to classify countries into Tier 1 and Tier 2, as well as question the very basis for placing India into Tier 2 countries for which a mathematical modeling estimate is used. India had also underlined the fact that given the accuracy of the mortality data collected through an effective and robust statutory system, India doesn't deserve to be placed in Tier 2 countries. The World Health Organization till date has not responded to India's contention. Dr. Jayadevan, is the bottom line over here that the WHO doesn't trust the data that India gives? It doesn't trust the civil registry, or it believes that the civil registry in various states is incomplete? Is that why there's this dispute? Is that why India is in this Tier 2 category?
Well, we know that India is a very large geographical region, as big as a continent. And my understanding is that the statisticians who calculated for the World Health Organization used certain mathematical models that Dr. Brahma alluded to. She said that you make certain assumptions when you calculate for the whole country based on data that comes in from certain regions. Now, I have here a paper from John Wakefield, who's a statistician, who used this modeling to estimate the deaths in India. He says, quote unquote, this is John Wakefield from University of Washington, Seattle. He says, we do not know for sure whether the assumption remains reasonable over the pandemic. In other words, they have looked at certain regions of India that are reporting in one way or the other the number of deaths, and they have extrapolated for the whole country. So the country has, with its own statistical methods, has contested it. I'm not a statistician myself, but I can see that there's plenty of uncertainty either way. So I would trust the data that's put out by the government rather than an external agency that has used certain models. Now, I'll explain it with a simple example for our viewers here. I know there's a lot of statistics here and it can be boring for our viewers, but I'll give you a simple example. Yep. Let's say we live in a housing colony and there are 4 houses. And your child, who's a high school student, has a project to estimate the net wealth, total money worth of all your 4 neighbors. Now, without interviewing them directly, you can look at their car, look at their clothes, look at the size of the house, check out their grocery shopping patterns, how much jewelry they're buying, and then estimate the amount of money they have. Each of these methods is okay, but they're not perfect. A better method will be to ask them directly how much they are making. So I know it's a gross parallel here, but this will ring with our viewers because there are different methods and models in statistics that you can use to find the truth. In statistics, you're always looking for the truth of a large population, and the larger a population is and the more diverse it is with different reporting systems. And as Dr. Garg said, there are so many variations within the country. It is an incredibly difficult task for any statistician to come up with the truth.
Okay. Professor Gaurav Vallabh, this deeply indicts every state government, arguably, in the country. It's not, so in that sense, it's not just Government of India and its claim versus the WHO. Every state, for Congress-run states, you speak for the Congress party. So is that the problem over here, that every state, or large state across the country, or most states across the country have made a mess of the data which they've presented, or they've deliberately underreported, which is an even bigger concern?
See, Vishnu, one thing which I want to highlight as a student of statistics, because the doctors on our panel from the government side are misleading. Because whenever any statistical sample is collected, it can't be on a particular region or a state. It has to be diversified. So please don't mislead that we can't extrapolate the Maharashtra death or Gujarat death or death in Uttar Pradesh and Andaman Nicobar is not having those deaths. Sample, whenever any sample is collected, whether COVID death or any financial sample or any statistical sample, it has to be diversified. That is the first rule. Second point, the doctor on our panel gave one example. The problem is precisely that when we are having 4 families, the person who is collecting the wealth data is not recording it correctly. That is the problem. And precisely government had not collected that mortality data correctly. That is the reason it is happening. And it is not the foreign agencies which are giving that 47 lakh people had died in our country due to COVID. In fact, some of our own internal Indian researchers, some news agencies, some Hindi newspapers had done similar type of exercises.
On the ground, yes.
Their data is more or less same. Their data is more or less same. And you know, Vishnu, what is the reason of these things? The reason is that the government wants to understate the number of deaths so that the compensation should not be paid. They are not eligible to pay the compensation because government is not interested to pay 4 lakh rupees as a compensation to each deceased family member. The second, they want to do the chest thumping because they had miserably failed in providing the oxygen, the remdesivir, both in the first wave, second wave. I don't know whether third wave is there or not, but in first and second wave, we had seen that our hospitals are not having beds. Our hospitals are not having ICU facilities. Our hospitals were not having remdesivir. Forget about remdesivir. In the rural India, we are not having paracetamol. When there is a second wave in Uttar Pradesh, and we had seen the dead bodies floating in river Gangaji.
Yeah.
So, problem here is that government is grossly misleading the data, is downsizing the mortality data so that compensation should not be favored.
Okay, Gaurav, let me get, because I'm running out of time on such a frightening topic, but PKD Nambiar, would you like to come in on this? Because the government says these WHO numbers are just not reliable, but you've heard everybody over here. These are some of the finest statisticians and experts monitoring this. Do we need to come clean on how many people really died? The difference between 5.2 lakh and 47 lakh is colossal.
Vishnu, there is no doubt that a number which the government is putting up is like a 500,000, little above the 500,000 figure, may not be accurate, I'm sure, and it may be much more than that. But the problem is that from the last January to March to today, the number of people who are coming with the different statistics, some people are claiming, the Lancet was talking about 6 times more than the government data, someone is saying 8 times more than the data, someone else is coming and saying it's 10 times. So the figure whichever different agencies are coming up with cannot be trusted at all. So one thing I need to really tell you that yes, of course, such a large country, the impact of COVID was limited to, the severe impact of the COVID was limited to few places. Like as Dr. Jayadevan said, for an example, Kerala was one of the very badly hit place with regard to COVID. But I can tell you, any death in COVID, related to COVID would have been registered properly in a place like Kerala, highly 100% literate state.
But you know, the thing is Kerala also recorded their deaths very well.
No, that's precisely. Now coming to the
other
part
states haven't.
So that's precisely the. Secondly, that blaming us, I mean, like Gauravji can definitely blame the central government. Please note that all these data which the government of India published belongs to every state. They give the data to the government of India and the government of India just publishes that data. They do not create that data by themselves. So I think let us not politicize it. But yes, there is one thing is very clear. The data which the government may be saying may not be accurate. It may be much bigger. But the kind of way, for an example, in the case of Vishnu, look at Russia. They are talking about 3 times more. And India, they are talking about 10 times more. The people, it's even worse than, according to the WHO data, we are at par with...
no, not at par. We are number 1 in terms of COVID deaths. It is a terrible number.
With regard to the COVID management.
Okay, 1 second. Dr. Jha, I have very little time. If you can just wrap this up, sir, 30 seconds. I'm sorry, I don't have
I was talking to me and Dr. Jha was on another show just 2 hours before. We were discussing the same thing.
Yeah, one sec, PKD. I just want... Yeah, Dr. Jha, go ahead. Yeah.
If the Indian government wants to get at the truth, then in the September 2020 census, put a question, was there a death in this house in 2020, 2021, 2022? If so, age, sex, and date. That will give you definitive evidence to settle this debate.
But again, cause of death? Because
you don't need the cause of death. You just want to look at excess deaths. And if there was an excess in particular weeks,
okay,
where a pandemic was raging,
right,
it has to be COVID.
Right.
Correct. Vishnu, which is a good idea. In fact, it's a very good idea.
Yeah, but again, we need to be transparent in order for that to happen.
But also one thing more. In India, you need to also be, one thing I am very clearly telling you, when the government has announced there will be some kind of a compensation for the people or being given, most of the people who are affected would have gone for that. So there are clear data by the government as well. You can't just blame the governments, irrespective of any state governments or a national government.
Well, that's something that needs to be looked at. That's something the Supreme Court has also been looking at. The actual rollout of funds for the families who've, who had somebody who's died. It's such a sad discussion to be having this, and we still don't know what the truth is out there. I'd like to thank you all very much for being with us and sharing your professional expertise on this very important topic. We're out of time. Goodbye.